Good morning, everyone. This is Adam Mayberry with the Joint Information Center with the Incident Management Team responding to the COVID-19 Washoe pandemic. Good morning. Appreciate you tuning in today. It is Wednesday, April 29th. We have a couple things to share with you. Quick announcements. We are going to have a virtual town hall series, the fourth in a series of 4 town hall Friday. We'll have one that's specific to the Spanish speaking population in the Reno-Sparks, Washoe County region. That'll be on this Friday at 1 o'clock. It'll be completely in Spanish with a lot of regional experts on the medical side and other areas. There'll be English sub captions, but want to make you aware of that. Again, that'll be on Friday at 1 o'clock. It'll be viewed on the City of Reno YouTube channel. Also, before we move into our speaker, I wanted to make sure everybody was aware of the dashboard that we have on the COVID-19 Washoe.com regional website. I'm going to go to that fairly quickly and just highlight a few things for you. I'm going to share the screen, so I hope I don't lose you.
Hey, Adam, this is Kevin Dick. I think you had the screen shared. There you go.
There, is that it? Okay, very good. Thank you, Kevin. Yeah, just real quickly, we have 19 data points, and I really want to applaud the Health District for their efforts as we've kind of moved along this process. This has evolved a bit, but this is the dashboard. You can see the total cases. I want to bring to your attention right here, click on for the larger dashboard. This will take you to a screen with some more data and some charts and graphs, some of which I think would be very good visuals for you. Down here, there's history, gender, age of the cases. We are working on getting the ethnicity for those that have passed away from COVID-19. Should have that later today. The case history here, I want to point this line out to you here. This is the active cases of COVID-19. You can see that starting to flatten. So that's what we mean when we talk about flattening the curve. And Kevin can dive into this a little bit more when he speaks, but basically as I understand it, the recovered cases here is essentially the confirmed cases minus the active minus the deaths. I believe that should give you the recovered cases. But again, want to point out this line here, the flattening of the curve, if you will. If you can click on this 7-day moving average. This is a fairly new feature as well. This yellow line here kind of gives you a better sense over the course of the COVID out. We've been tracking the numbers. There was a little bit of an uptick, if you recall, right around the Easter holiday. That's what this is generally reflective of. But you can see that we are beginning to flatten a bit. We'll go back to this curve. So here at the 90-yard line, if you will, we want to make sure that we get into the end zone. So continue to help us with the message of social distancing, staying at home, wearing the face mask and that. So I'll take you back. Can everybody see me? Yeah, I did it. Okay. So make sure you take an opportunity to look at that dashboard. If you have any questions, please let me know. We're going to lead off this morning with Vice Mayor Devin Reese, City of Reno. I learned a few days ago through the Reno staff that the Vice Mayor was experiencing some symptoms of COVID and went online and got tested. He's agreed to share that experience with us because it's been very difficult for us to find anybody who's willing to talk about that experience. So again, the goal here is to really raise the level of testing, the fact that it's available, that it's free, it's very non-intrusive, if you will, it's quick. And so we appreciate the Vice Mayor sharing his personal story, his personal experience. And I'm going to turn that time over now. So thank you, sir, for joining us, Devin.
Thanks, Adam. Appreciate all that you're doing and keeping our community safe.
Thank you, sir.
Hopefully everyone can hear me at this point. So yeah, Adam shared briefly my story. On Sunday, I guess, I started to feel some symptoms that may or may not be consistent with COVID-19. Like everybody, everyone's worried that every sniffle, every cough, every headache might be, this deadly virus. So I sort of sat on it for a couple of days. And then in one of our meetings, I understood that the community was going to be ramping up testing. Mr. Dick from the health district had been sharing that message, but that we maybe were not able to fulfill even all the testing that we could do. And so I agreed to be tested and then to share the experience with everybody. I did that this morning. I went down this morning, and it was, super awesome, easy, obviously free. It was on the ground to the Livestock Event Center there off Wells and Sutro. Wells on one side, Sutro on the other. So it was all drive-in. It was fast and certainly convenient. There was really no contact between me and anyone else other than the nurse who did the testing. They came to my car window. I rolled it down. She explained the process, ultimately had me sign a form. They gave me a new pen that had never been used by anyone else. I kept the pen. I signed the document. They gave me, this instructional paperwork. It's in English and Spanish. And then I had to, quickly blow my nose. Then I had to have them do some nasal swabs. And quite frankly, I was anticipating, a nasal swab of like this length, and it was really much smaller. And it did not hurt. It wasn't painful. It didn't feel great either, but didn't hurt me. And the nurse took the swabs, put it in the testing kit, took it away, and we were done. So super easy. And I understand the results will come to me in about 24 to 48 hours. Also, when this all started, I guess I left out the part that I just got on the website and did the initial intake. That intake took me maybe 3 or 4 minutes, nothing. Asked me some basic questions about travel, which I had not done, but asked me some other questions. And now as we ramp up, I know they're going to expand the number of people who can get it. And as I understand it, essentially, it will be available to everyone. And so awesome job. Super impressed by the logistics of it. It is an enormous undertaking to set up. And so I thank all those who've been involved in doing it. So that's my story.
We also have pictures from the Vice Mayor getting tested, and we're going to share those with you following this event as well. You're free to use those. Is that correct, Mr. Vice Mayor?
Yes, forgive the haircut. My husband watched a few YouTube videos this weekend and clipped my hair, so don't look too carefully at the haircut.
Very good. Any questions for the Vice Mayor?
Yeah, Brian Hoffman with 2 News. Can you hear me okay?
Hi, Brian. Yes, I can hear you just fine.
Yeah, I was wondering at what point did you feel like you needed this test? What symptoms were you showing at that moment?
Yeah, so I was experiencing really the 2 primary symptoms were a cough, and then I had what I'll call nausea, upset stomach, that kind of thing, not vomiting, but those were my primary symptoms. I've also tried to take my temperature pretty frequently over the last several days, and that really hasn't been the issue. I thought too, there was a morning when I woke up and I felt a little foggy, and it's not that I didn't have enough caffeine or coffee on board, but I just felt foggy. And that was really the thing that triggered it for me. I mean, ultimately there are 4 other people in my household. I wanted to make sure that if I do have it, that we figure out what we need to do and keep people safe. I've obviously not been going out into the community since any of this happened, but really that was it. Is just a sense of concern coupled with the fact that I knew that our testing was going to ramp up, but yet we weren't really getting out the information so people knew that testing was available. So I figured I could get the testing and also be a guinea pig.
Very good.
Hi, Councilman. It's Ann Jeanette from the Reno Gazette-Journal. Appreciate you sharing your story.
Sure.
I mean, you're a busy guy. You're the one sitting in council chambers when there's meetings. You're running for office. You were serving meals to senior citizens on Saturday. I guess, can you talk a little bit? Are you staying home now that you have symptoms? Are you worried about spreading this before you became symptomatic? And what measures should you or others be taking to kind of avoid that?
Yeah, for sure. I am busy. I feel like I'm busier now than I've ever been, but I'm mostly in my house. So I have been tasked with running the council meetings. And then on Saturday, we were out in the North Valleys delivering meals to some folks out there. Yeah, it is concerning because I understand that sometimes the symptoms don't present themselves right away, and then you're essentially a carrier. Fortunately, when I've left the house, it's always been with good, mask, gloves when we were out in the North Valleys, hand sanitizer, all that kind of thing. And then we've set up at our household a sanitizer station when we come into the house, where we just have some hand sanitizer, gloves, masks, all that sort of thing, and we're leaving our shoes outside. So at the end of the day, I think it's kind of a difficult question to answer because I want people to stay home. I also think it's important that we all stay safe. And yet there are a couple of things in my official capacity that I just have to get out and do. Right now I'm not going anywhere because I want to make sure that we get the tests back and that they're negative. But you're entirely right. We've got to do everything we can just to make sure that we're not spreading the virus unknowingly. And I hope that I've taken the good precautions.
And good question from Bert Johnson. When does the vice mayor expect to get his results back? The answer to that is 24 to 72 hours. If it's positive, my understanding is closer to the 24-hour mark. And we'll have, I'd like to have Kevin Dick follow up on that on the timing. Any other questions for the vice mayor?
I did have one more. Brian Hoffman with KTVN again. I was wondering if the tests do come back positive, will you be informing any of those seniors that you delivered food to, or would that then be placed upon the county to inform them and to provide any testing if needed?
Yeah, I think if the test comes back positive, and let's knock on wood that it does not, we're going to have to talk about that kind of contact tracing that everyone's talking about. I think we'll work with Adam Mayberry and Kevin Dick and the health district to figure that out. We were working with Reno Housing Authority. And I think, as I said earlier, I wasn't really interacting with folks. I was more the logistics side of it. So I didn't walk into anyone's home. I had masks and gloves on. I was more there to walk around and make sure the deliveries happened. We had volunteers from the community who were making the actual deliveries and the Reno Housing Authority. So I might not have really come into contact with anyone very carefully or closely, is what I mean. We'd have to look at it. And I know that that's part of the issue with, contact tracing is just being as detailed as possible. But certainly we would want to make sure we go through that process and really narrow down who I might have had any contact with. That would probably be the only one that I can think of, though, because all the other ones were really essentially contactless. And again, I'm trying to observe all the social distancing norms. So there were no hugs or high fives or anything like that going on.
Thank you, sir.
Any other final questions for the vice mayor of Reno? Okay, seeing none, you're free to stick around, Mr. Vice Mayor, or we can let you go. We certainly all hope that the test comes back negative. Appreciate you sharing your story, sir. Thank you.
Thank you so much. And I'll hang around, but I'll be on mute and all that good stuff.
Good. Glad to hear that. Thank you. we'll turn now to Kevin Dick for our update on from a health perspective and what's going on. Kevin, thank you again always for your generous time.
Thank you, Adam. And I'd like to begin by letting the Vice Mayor know I'm sorry he's not feeling well. And I certainly as well hope that he has a negative test result. But I also want to thank him for sharing his experience with the community and letting people know how easy the process is to contact the health district either through our website or our call line, the 328-2427, to get scheduled for a test if you have any of the symptoms of COVID-19. And so it's it's a personal experience that he has that he's relaying to us. So I appreciate that he's sharing that with us. And he's given me a little courage to perhaps allow my wife to attempt to do a haircut for me. Vice Mayor Reese, I want to let you know your hair looks terrific on the computer screen. So he did a good job. I will provide the update for today for Washoe County. Sadly, we've lost another Washoe County resident to COVID-19. It was a male in his 70s with underlying health conditions. This is our 30th COVID-19 related death in Washoe County. We did have 24 additional recoveries, and we have 14 additional positive COVID-19 cases that we're reporting. So this brings our total COVID-19 cases in Washoe County to 848. The total deaths of 30, recoveries of 321, active cases of 497. Currently, we have 37 individuals that are hospitalized, and we have 64 individuals who have been discharged from the hospital. Our hospital and our hospital bed capacity remains good. We have 56% of our short-term acute care beds that are occupied, 45% of our ICU beds occupied, and only 20% of our ventilators are in use. And so you've probably seen in the news that the governor has approved our hospitals resuming elective surgeries as long as they're managing that situation and working with us to be able to change course if we have any increase that we're seeing that causes concerns about hospital capacity into the future. So this is good news for us. And Adam showed you some of the information that's available on the dashboard. And I wanted to remind people of the curve that he showed you of the 7-day rolling average of the new cases that are reported on a daily basis. And that's a really important one to be looking at. And I think what you'll see there is that we did have a high point to date that was right around April 15th, which is the date that the Los Alamos National Lab model first had predicted that we may have hit the peak. But what we're seeing with that as well, and thank you, Adam, for bringing that back up. But what we're seeing with that is it's also kind of a broad plateau that we're moving through from right around the beginning of April up to that high point and then back down to where we are today. So we really we need to continue to observe our social distancing practices and stay home for Nevada to continue to make progress with the reduction of those numbers of new cases. And well, I like the football analogy, Adam. I'm not sure I would say that we've just got 10 yards to go. I think that the top of that curve is really kind of the 50-yard line for us as we're working to try to get back down on the other side. So we need to continue those efforts. in that regard, and as far as our work forward, we've been working to expand our testing capacity in accordance with the governor's direction for our path forward for reopening. And we've been working to redesign the post that Vice Mayor Reese went through this morning for a sample collection to continue to expand our capacity for people to be able to be tested there. So we have developed plans where we can scale up the number of people that we can test there up to 900 people in a 4-hour shift. And if necessary, we could staff 2 shifts a day, one in the morning and one in the evening, to provide us with a collection capacity of 1,800 people per day. We also are working on plans to expand testing of some of our people in our long-term care and healthcare facilities, our first responders, and vulnerable populations, such as the population of homeless that are at the shelter facility. So we have a number of test kits that are from a lab in Southern California, and we're in the final steps of being able to have their data reported properly to the state to be able to begin using those. And so we'll be expanding that testing as well moving forward. So I wanted to reemphasize the message from the Vice Mayor that if anybody has symptoms, we will have you tested. So please contact us through the website or through the phone line. And to remind people that, if your allergies are worse this year than they've been previously, or you're developing allergies now and you haven't had those in the past, that may be a sign that you are infected with COVID-19. And so please contact us and get in. The testing is free and it's easily accessible. The state lab is also working on several different strategies for increasing their testing capacity at the lab. They expect to have their capacity doubled by Friday. And they also have some plans to be able to deploy some additional equipment that may triple their capacity if we're successful with that effort, if they are, through the early and mid-May. So a lot of work that's being done around testing. And then lastly, we did have a request for information on a number of healthcare workers that have been infected with COVID-19 in Washoe County. And looking at the data that we had as of Saturday, we had 133 healthcare workers out of the 792 cases reported then. So about 17% of the cases that we had in Washoe County to that date were healthcare workers. So I wanted to provide that information for you as well. So that concludes my briefing. I'd be happy to take any questions.
One quick thing for Kevin. Kevin, can you also clarify on the dashboard the ethnicities? I want to make sure everybody understands that does not represent 100%, because if I understand it correctly, it's only those that have actually responded to the question, correct?
That's correct, Adam. And I believe on the dashboard, we do have information on there of where race or ethnicity is unknown. So there's a bar where you can see how many people we don't have that information for, but then also from the people that did provide that information, we're displaying that on the dashboard.
And I'll heat to you on the 50-yard line. I apologize. I was never a very good athlete, so 90 just sounded better to me. But I appreciate where you're coming from. Thank you, Kevin. Any questions for the health officer?
This is Stanton Nicolo. So I've talked to a dental hygienist who's been laid off, and she said that they cannot go back to work until they have PPE because obviously they work in a high-risk area. Is there sufficient PPE for the other medical procedures and the elective procedures and the dentist to get back into operation?
Well, it's kind of a two-part question. So I'll start with the PPE for the elective surgeries, and that the governor's direction on that, and the proposal from the hospitals to the governor as well, was that those surgeries would occur only as the hospitals continue to maintain adequate capacity, adequate supply of PPE to be able to accommodate that. As for the dental offices, I can't comment as to whether they have adequate PPE, and I would suspect they probably do not across many of the offices. That's an area where we're continuing to work with state DEM and our incident management team to be able to procure PPE equipment for distribution to healthcare providers as well, and that would be commercially, as well as if anybody has PPE that they can donate. So I can't comment that or make a statement that we're going to have that full capacity across our dental providers.
Bert Johnson with Cap Radio News, if it's all right if I, yeah, thank you. So NPR National published an analysis this week about the amount of contact tracers on a state-by-state level. They found that Nevada only has around 2.5 people who are capable of doing contact tracing per 100,000 residents. But according to the experts they spoke to, the ideal during a pandemic is to have 30 of those per 100,000 residents. So I'm wondering what the county is doing right now to try and address that shortfall. Do you have plans around expanding that capacity?
Yes, we do. And we have ramped up our capacity for the contact tracing. And so for, and the contact tracing is done when we have somebody who's positive, test positive. So I could also follow up on that question to Vice Mayor Reese. We certainly hope that he isn't a positive, but if that were to be the case, the health district would interview him regarding his contacts, and we would be responsible for then following up with any of those individuals to inform them that they had potentially been exposed to COVID-19 and to quarantine through that incubation period. But for every 800 tests per week that we complete, we have an epi unit of 1 statistician, 1 manager, 2 epidemiologists, 15 disease investigators, 5 case tracers, 2 admin assistants, and 2 data entry individuals that are at work on any given day over a 7-day period, so 24/7. So we have plans for how we can expand that capacity as we increase our testing. Fortunately, right now, we have the National Guard that has joined us and are integrated into our operations. We have 33 additional Guard members on top of the folks that were working with us last week that arrived on Monday, and they're being trained in that contact tracing work, as well as for support in the call center and for assistance with the post. So they are a part of our workforce expansion to accommodate that right now. And we are working on plans for how we establish the longer term staffing capacity that we need for that, understanding that the Guard is not going to remain mobilized throughout this period, and we're going to need to continue to have that contact tracing work happening until we have a successful vaccine down the road. So your number, I think, is accurate, of the approximately 30 staff per 100,000. We are working also in a work group with the state and the other health authorities. And based on our population, I believe that number is about 144 people in that contact tracing group that we would need to staff up for. And so we're actually have a meeting this afternoon to talk about what are the trigger points and how do we move from where we're at now with the additional resource that we have from the Guard and from other county employees that have volunteered to help with our call center work, other people that are within the health district that are out of their normal jobs helping with that. And so we'll continue to move forward to implement those plans. We don't yet have the funding from the federal government that's being provided to support the that work. The federal bill has 11 billion in it that is allocated to state and local governments for testing and contact tracing. So we hope to have more information about that resource and how it'll be allocated in Nevada, and hope to have that soon.
Thank you.
Hi, this is Ben Spillman from the Reno Gazette-Journal. How are you?
Great. How are you doing?
I am doing okay, and I have a question about the issue of crowding in the Tahoe area. I'm sure you've heard a little bit about that. Specifically, Commissioner Burke-Bigler and she said Commissioner Young are kind of hoping that there might be some sort of statement from the county health officer, similar to what was in El Dorado County, asking people who don't have business or reason to be up at Lake Tahoe, Incline Village or Crystal Bay, to not go there. Is that something that they've communicated to you? Is that something you think might be forthcoming? And if so, how would?
So what I would say is that I would discourage people from going to locations where they end up being in a congregate type setting if there's a lot of crowding that's occurring. And I'm aware of those situations occurring at trailheads here closer to our community and at locations up around Lake Tahoe. And so my advice would be to avoid being in close proximity to others and to practice the social distancing measures that have been put in place. I think that's consistent with the messaging that's been coming out from us and from the governor's office for this pandemic episode that we're dealing with.
Have you had any communication on just kind of the issue of outdoor recreation in general, where you've talked to recreation managers and like how this should look in practice based on what we've learned as the science has evolved on the level of a risk that's involved with, being outdoor space versus indoor space and how that might be mitigated?
We haven't had any of those conversations. We've been communicating with our community about the facial coverings and the maintenance of 6-foot separation.
Great, thank you.
Hi, Kevin. This is On with KUNR. You mentioned that as testing capacity increases, you'd like to see more testing done at hotspots at long-term facilities. So what is being done now? Is it just for people who are symptomatic, or is it also for people who are asymptomatic? What's going on at those spots?
So for those facilities that I mentioned, long-term care facilities, other healthcare facilities, our first responders, vulnerable populations, those are the populations that we will begin to be testing, not just symptomatic, but asymptomatic individuals as well. We don't yet have a plan for the testing of everybody in the community, but we do have the plan to move forward with the testing capability that we're developing and the tests that we've secured from the commercial lab to be able to do that broader testing for those particular vulnerable populations. For the remainder of the community, if anybody has symptoms that's contacting us either through the website or our call center, they will be scheduled for testing as well.
And then what are the hotspots that you are seeing in Washoe? I know that there's been outbreaks at, several facilities, a nursing home and a long-term behavioral health facility for children. Are you seeing others in the community?
Yeah, we've seen others, and we're actually working on data to provide with a breakdown of cases that we've seen in different types of workplace environments and others. So, we have construction companies where we've had outbreaks occurring that include also landscapers. We have warehouse facilities. We have the healthcare workers that I mentioned, but also a significant number of people that have had COVID-19 that are either unemployed or retired. So it's not just workplace settings where people are being exposed.
And then with the healthcare workers, can you clarify, are they healthcare workers in hospital settings, or is it a broad range that includes like long-term facilities? What kind of healthcare workers are we talking?
That's a broad range that would be healthcare facilities across our community.
Thank you.
Kevin, this is Stanton from Colo again. I know you've been testing more people. Do you have a percentage of positive tests among the total number of tests so we can see if that number is dropping?
I don't have that number to provide for you right now. The state is beginning to put that on their website for statewide numbers of positivity. So you can find that information there now, and we're working to get that information put together to be able to provide for you.
Are you seeing a decrease though in the percentage of positive cases, even if you can't give us a number?
I can't do that calculation off the top of my head to give you a number or to tell you the decrease.
Any other questions for Kevin this morning?
This is Brian Hoffman with KTVN. Real quick, I know you aren't able to speak on the governor's phase 1 plan, but corresponding to what he kind of laid out what it was, are we actually seeing, at least in Washoe County, that beginning of that 14-day period with the decrease in COVID-19 hospitalizations and percentage of people testing positive?
I think that we're optimistic that we're seeing that. I mean, we've got it's not going to be a smooth curve, but when we look at that 7-day moving average, it looks like we definitely have a downward trend in new cases that have been reported since that the high point on the 15th, when you smooth out the kind of jagged graph that you get from the daily reporting of cases. The Hospital Association put out a graphic yesterday that's on their website. If you haven't seen that, that's shows you the hospitalizations for the most of the month of April, that shows those downward trends occurring.
Thank you, sir.
This is Siobhan from the RGJ. I think it was Monday you said you had 2 people in the call center at the health district who had been tested. Did you test more people in the health district? Were there any other suspected cases in your call center?
We did quarantine people if they had been in contact with the people in the call center, and we haven't had any additional cases identified to date.
Thank you. Any further questions for Kevin before we end the call and resume it on Friday? Very good. Thank you again, Kevin. Thank you for your time today, as always, and we will look to hear from you all on Friday. Have a wonderful rest of the week.
Thank you.
Thank you, Adam.
Thank you.
Thanks, everybody.